Let's come up with some reasons why we need to screen for breast cancer. These are reasons that you need to take away to your community, if you're a GP, to take away to your patients. And this is going to drive home that screening is very, very important. So breast cancer is the most common cancer diagnosed in women. So it's really common. Statistics in Australia say that 1 in 8 women, by the time they turn 85, will have breast cancer. So if you know 8 women, you will know at least 1 woman who has breast cancer. And I saw lots of hands go up then when when Dr. Singh asked the question, do you know anyone who's been touched by breast cancer? So it's really a very, very common disease. So on average, about 38 women are diagnosed with breast cancer every day. And you can see the other common cancers there. The next most is bowel cancer, melanoma, lung cancer, and other lymphoid cancers. And breast cancer is really common. More than double the cancers that we see in New South Wales and Australia are breast cancer in women. So it's common. It's an extremely common disease. So someone you know will be touched by breast cancer. So this is a good reason to screen. The next important fact is that the incidence of breast cancer is actually rising. In 2008, the risk of breast cancer by the age of 85 was 1 in 8. And in 1985, it was 1 in 12. Actually, it's now 1 in 8. It used to be 1 in 12. And you can see that the incidence projected towards 2020 it's rising. It's continuously rising. So you might be asking, why is this the case? Why is the incidence of breast cancer going up? And it's partly due to hormonal factors, longer reproductive lifespan. In Western countries, the incidence of breast cancer is higher. That's due to lifestyle changes. There's lots of things that cause breast cancer and lots of changes in the environment that have happened, and that's leading to an increase in the rate of breast cancer. So the 1 in 8 will become much higher as we go towards 2020. So this is a common disease that is set to be even commoner as we move towards the next century. And the aging population is contributing to that. So what we predict is that in 2020, it'll go from what we see last year, 14,000 odd women, to 17,000 odd women. That's a steep increase. So the incidence of breast cancer is increasing. It'll continue to increase. It's a common disease. We need to screen for it. We need to be doing things to pick this disease up early and treat it. So why do we say that the optimal age for screening is between the ages of 50 and 74? So this graph here is basically showing the incidence of breast cancer according to their age group. And you can see that the highest incidence is around the 60 age group. And between the ages of 50 and 74, that's when we see the largest number of breast cancers. After 74, it starts to taper away. So that's why we screen in that age group. Okay, so that's the most common period in your life that you will be diagnosed with breast cancer. And it's also that 50 to 74 age group is also the most amenable to mammographic screening. And we'll talk a little bit more about that as we go along. So this is talking about the incidence of breast cancer across the world. And you can see that Australia has one of the highest incidences of breast cancer, 4th from the top. But when you look at some of the Asian countries, the incidence is much lower. And sometimes a lot of Sri Lankan and Indian women will say to me, well, I don't need to screen for breast cancer because it doesn't happen in our community. It's not very common with us. That's a disease of Australian women. But actually, that's not the case. It has been shown, and there's good data to show, that once a woman leaves her country of origin and moves to another country, such as Australia, they take on the risks of that country. So that high incidence of population that you see in Australia, that applies to us. That applies to our women as well. So it's really important that you drive that home. It isn't a disease that just Australian women or Anglo-Saxon women have. It's a disease that affects all of us. So this is just showing the survival from breast cancer. And you can see Australia, the survival rates are the highest. And there are good reasons for that. And one of those reasons is screening. And another reason is that we treat breast cancers really comprehensively, really well. We have very high-class diagnostic facilities here in Australia, and we put a lot of effort into treating our women. So that is to prove that if you pick up cancer, it's very treatable. At an early stage, it's very treatable, specifically in Australia, because Australia has very high standards of breast cancer treatment across the world, the best in the world, in fact. So it's good to pick it up early because we can treat it. Something can be done. And screening does impact survival. You can see this is looking at mortality. The mortality rates from breast cancer, so the risk of dying from breast cancer over the period of time from 1972 to 2008. And you can see the dotted line there shows just when the mammographic screening began in Australia. And in New South Wales, actually, that's from New South Wales. We were the first state to undertake this. And you can see that the mortality has started to decrease once that screening program was introduced. So the evidence is clear. Screening works. screening will save lives. So the other common thing I get asked is, oh, you know, I don't think I'm at risk for breast cancer. There's no one in my family that has breast cancer. But actually the risk factors for breast cancer are very diverse. We all ask ourselves, oh, what causes breast cancer? It's not one specific thing. It's lots of things, and it's a combination of these things that work together to produce breast cancer. It's never down to one thing. So 99% of new breast cancers, you know, occur in women, 1% occur in men. Most women are over the age of, are between that 50 to 69 age group. There's reproductive factors that lead to increased risk for breast cancer. So having your periods early, or having a late menopause, so a long reproductive cycle. If you don't have children, there's a higher risk of breast cancer. Alcohol and obesity, hormone replacement therapy, and family history only accounts for a very small percentage of actual breast cancer. And it's a multifactorial cause. So what that means is it's all these features acting in combination, and every one of us will have at least one of those risk factors. This means that everybody is at risk of breast cancer. It's not just those people who have a family history, it's all of us. All of us women are at risk of breast cancer. It's a common disease. So a little bit about population-based screening. So what that means is we try to screen as much of the population in the target age group as possible. And the aim is for us to pick up that breast cancer before you can feel it, before it becomes a lump, before it travels to the axilla. So the chances of survival are much improved, and I've shown you that with definite data there. The program is free to all women over the age of 40, but we really target those women between the ages of 50 and 74, and we actively send them out invitation letters, but they still don't come. I'm not really sure why. But we can see that there's been a significant reduction in mortality since the time this program was introduced into New South Wales. So it really does work. And I can tell you firsthand, as a person who works at the Breast Cancer Institute, we see hundreds of breast cancers, about 400 or 500 a year at Westmead, because we're a tertiary quaternary referral centre. I can tell you there's a big difference between the women who were picked up early in screening and those women who present because they come with a lump. So they've waited, they haven't had their screening mammogram, and they come with a lump. And there's a big difference. You see women of the same age group and very different survival, very different treatment courses. And it breaks my heart that these women aren't going through the normal screening process, which is there and available. So we like to screen every 2 years, and you have to screen every 2 years. It's not just about getting one screen and then that's it. No, it's every 2 years. That's the whole part of this program, is that it has to be every 2 years, because it can occur at any time in that lifespan of 50 to 74. And so you have to do this repetitively every 2 years. I've told you that the highest incidence of screening, highest incidence of cancer is between that 50 and 74 age group, and that's why we screen in that age group. Under 50, mammograms don't work as well, and I'll show you why. So a really important thing is that the BreastScreen service is a very high quality service. Much higher quality than you'd get in private radiology practices, in fact. There are hundreds of standards that we need to meet in order to provide this service, and Madhi has to do the same thing as well. We've got very specific training. We have to meet a lot of criteria in order to produce this. Every mammogram that a woman has is looked at by at least 2 radiologists, or 2 independent radiologists, to confirm the presence of that cancer. So if one misses it, there's a chance that the other will pick it up. And then it goes to a third reader as well, if required. So the standard of mammography, and we use digital mammography nowadays in New South Wales, it's very, very high quality practice. And we have to really meet a lot, over 150 standards, is that right? 177 standards that we have to meet in order to just provide this service. So it's a really good service, a really high quality service that we provide. So this is an example of a mammogram, and you can see that within this 2-year period, this woman's picked up this tiny little cancer here, and that's probably about 7 or 8 millimeters in size. When it's that small, and you can probably see it there, so when it's that small, you know, they're very treatable. They're very treatable with minimal sort of cosmetic changes to the woman, with minimal chances of them needing systemic chemotherapy. So it really does work. You can see that in a 40-year-old woman, they have different breast tissue. We don't do mammographic screening in women under the age of 40 because the breast tissue changes. As you get older, it gets less and less dense. There's less, it's like a scaffold within the breast, fibrous tissue. And when the breast tissue is very dense, it's very difficult to see cancers. And you can see that the tissue of a woman who's under 40 is very dense. You won't be able to see a little white fleck there, whereas a woman over the age of 50, you can use that mammography very effectively to pick up cancers early. So that's why we screen in that age group. And the clinical service we provide is we make sure that the radiologists and the pathologists concur in what they see. We have meetings that we sit down together and discuss each and every patient that's diagnosed through the breast cancer screening program. And we make sure that what the pathologist sees, the confirmation of the diagnosis, is also what the radiologist sees as well. So we work together as a team, a very effective team. So it's a really high standard of clinical practice that we use here at the breast screening program. It's high quality, it's highly accurate. We are measured by how accurate we are, and if we don't have accurate reading, an accurate mammography, an accurate diagnoses, we actually can't get accreditation to provide the service. So we are monitored very closely year on year to make sure that the standards that we provide are really high. And we have highly skilled radiologists who are dedicated towards breast imaging, and a multidisciplinary team, and we also provide counselling and support for all women who are diagnosed through the screening program. So it's a really good program. So why should we go to BreastScreen? Number one, it's free. It's a free service. How come we're not using it? Why can't I get women through the door when I'm providing a high quality service that's free? Breast cancer is really common, 1 in 8 women. We have to screen for this. We have to find these cancers early. If they come late, women are going to be sicker, they're going to need more intensive therapy, and it's not good. Early detection saves lives. We see that in our population statistics that I've showed you. And you know, it really does decrease the mortality from breast cancer. So it really lessens the impact of the disease. Yes, you have a diagnosis of breast cancer, but it is treatable. We can do something about it if we pick it up early. And the quality of service we provide is exemplary. It really is. We're very lucky in Australia to have this. And I need you to help me get more people through the door. I need you to help me make sure that we're using that high quality service, that we're saving women's lives by picking up these cancers early. So I couldn't be more emphatic than that. Thank you.